Um, a pandemic is a unique situation in which we believe that all citizens on the planet will likely be exposed to a virus within a defined period of time. We can say that, and I've said in previous press conferences, if this was influenza, we would probably have called this as a pandemic by now. But what we've seen with this virus is that with containment measures, with robust public health response, the course of this epidemic, or these multiple epidemics, can be significantly altered. And to declare a pandemic, it is unhelpful to do that when you're still trying to contain a disease. A pandemic is also a word that may be attractive at a global level to describe an event, but it's not necessarily so if you're one of the 2 billion people living in countries with weaker health systems, because what's in that sense you're accepting, as I said to my colleague from Mexico, is that you now are entering a phase of mitigation and that you're giving up on the possibility of containing and slowing down the virus. So pandemic as a colloquial term, we've seen the pandemic of obesity or the pandemic of HIV or all of these words that are used. We want to move beyond colloquial terms. If we say there's a pandemic of coronavirus, we're essentially accepting that every human on the planet will be exposed to that virus. The data does not support that as yet, and China have clearly shown that that's not necessarily the natural outcome of this event. If we take action, if we move quickly, if we do the things we need to do, that does not need to be the history of this event. But if we don't take action, if we don't move, if we don't prepare, if we don't get ready, that may be a future that we have to experience and we have to endure. So much of the future of this epidemic is not in the hands of the virus. A lot of the future of this epidemic is in the hands of ourselves. And those countries who've taken control, who've taken responsibility, have clearly shown that a lot can be done to stop this virus.